I'm living here with my friendly little tumor.
Almost 5 pounds.
Oh my goodness.
He's living with that attached to his face?
It's basically blood vessels and cartilage all intertwined in a dead mass. It started as a little pimple by my ear. I tried to squeeze it, obviously didn't break. And then when it was about the size of a pea, tried squeezing it some more and had somebody else try and it wouldn't break.
So what type of growth is this? Well, there are a lot of different things that it could be. The first thing is it could be a neurofibroma. You may see videos, and we've had some recently, where you can see people who've got these huge masses attached to their body, and they're these neurofibromas, which are essentially tumors attached to nerves that can keep growing bigger and bigger. Now, he does mention, however, that there is cartilage and other types of things in this tumor. There is a tumor called a teratoma, and this is an odd tumor where you can actually grow cartilage, you can actually grow teeth and hair inside of these benign tumors. It's kind of strange, and it's something that we learn about in medical school. But the best way to find out exactly what this is to biopsy it, send that biopsy specimen to a pathologist, and they will look at it under a microscope and tell you what it is.
And then one morning I woke up and it was about the size of a small Super Ball. And at that point, I started kind of looking online, and everybody said, oh, it's a sebaceous cyst. Don't worry about it.
Well, that doesn't look like a sebaceous cyst to me. It is a lot larger than that. Sebaceous cysts are also called epidermal inclusion cysts, where essentially you get skin that gets trapped underneath the surface of the skin, and those skin cells that are trapped underneath the skin can still create oil and sebum, and that can create this kind of cyst pocket below the skin. Those don't get anywhere near this large.
It was, the size of like a hacky sack ball to a racket ball to a tennis ball, and just continually kept getting larger and larger. And it's still stretching.
So the question is why wouldn't he get this removed before it became so massive? Now, sometimes people are afraid of the medical system, and they're afraid that if they go get it treated, that they're going to have a diagnosis that they don't want to hear, like let's say cancer. Other times it can be financial. Even though we do technically have Medicaid for people who don't have enough income to provide for their health care, some people unfortunately slip through the cracks, and they make, let's say, too much for Medicaid, but not enough for private insurance.
It's just dead weight moving around. But it's not fun because all this side of my head, my eye, and then it pulls from my back shoulder, everything this way. And that's where I get all my tension headaches and stuff from, is primarily from that.
Can you imagine having a 5-pound weight just hanging from the side of your face? Interestingly, as you look at it too, it actually grows hair, almost like in a beard-like fashion. So this is very unusual. I really hope that this poor guy gets this taken off. To take something like this off that's this large, though, is definitely risky, especially with the different nerves that go through that part of the face. He could potentially end up with half of his face paralyzed.
The biggest obstacle, and probably the main reason it has been stuck on my face this long, whether it's 20 grand or it's 200 grand, it doesn't matter. I don't have that money.
And that, my friends, is a sad state of American healthcare today. There is so much money being spent on third-party payer administration, on basically paying insurance companies and insurance companies denying requests and all of that, that you get somebody like this who truly needs help with his medical care, and he can't afford it. It's absolutely, astounding that we allow something like this to happen in our industrialized, wealthy country today.
They said the longer it grows, the greater chance of it to become a malignant form of cancer. That's really my only nervousness towards anything.
So it's pretty uncommon for a neurofibroma to turn into cancer. One thing that this could be is a pleomorphic adenoma of the parotid gland. That's a lot. Pleomorphic adenoma is a benign tumor of the parotid gland that starts. The parotid gland basically is a saliva gland that's basically on the side of your face. And these types of tumors initially start off real small, but they can grow to be quite large. I've seen some textbook photos of people with fairly similar presentations of these huge masses hanging from the side of their face, and they're benign pleomorphic adenomas. When they get to a certain size, they believe about 10 centimeters or larger, it becomes a giant pleomorphic adenoma. Is that what he has?
Today is Tim's surgery, and we will be performing a massive parotidectomy.
So that's what it sounds like it is. They're going to remove a portion of the parotid along with that entire tumor, most likely, once again, a pleomorphic adenoma. Now, 85% of tumors of the parotid gland are benign. And of these benign tumors, 80% are pleomorphic adenomas. And if that pleomorphic adenoma has been present for less than 5 years, the risk of it becoming malignant or seriously cancer is about 1.5%. However, if he has had this for longer than 10 years, that risk goes up to about 10%. So that's why it is a good idea to get rid of this, both for his cosmetic sake, but also so it doesn't develop into a malignancy and become very dangerous.
Should we navigate removing this tumor without causing any permanent paralysis? One of Tim's primary concerns was, will he have a concavity after taking so much volume away?
In these types of cases, when I do things that are big like this, and I have never removed a pleomorphic adenoma, especially one this big, cosmetics usually is a little bit of a secondary thing. The goal is to make sure that they are functional. Now, there are branches of the facial nerve that go through the parotid gland, and the facial nerve is the motor nerve to the muscles of the face. So if in the process of removing portion of his parotid and that tumor, you cut through the facial nerve, it can cause parts of his face to become paralyzed, possibly permanently. So that would be my first main fear of this operation. The second thing is that is so huge, it has to have a blood supply to it. There must be large blood vessels going to supply blood to it, and making sure you don't get into a situation where he's losing a ton of blood, that could also be very dangerous. The fact that he may have a bit of a concavity or something like that, I really would try to encourage the patient to consider this very secondarily. That's not the big issue here. We got to make sure that you're not paralyzed in your face and that you don't bleed to death.
The nerves were not cut, and we were able to take the tumor out in one piece, which minimizes the chances of a recurrence. But I don't know if there's any facial paralysis. There's no possible way for me to know until he wakes up.
So I find that interesting because there are nerve stimulators that you can use in the operating room, and depending on if you actually spot those facial nerves, you can actually stimulate those nerves to see if they're still working and if those muscles are still moving. On the flip side, he may have also tried to dissect this so he doesn't see those nerves. I don't want to see your facial nerves if I'm doing a facial surgery on you. I'd rather be far, far away from it. That could also be the case, in which case then the only way to know if those nerves have been damaged is to wait for him to wake up and see if he can make all the different facial expressions.
Do a few things for me, okay? Can you raise your eyebrows? Can you close your eyes? Can you pucker your lips? All good. Everything's moving.
That's the same thing I do sometimes if I do facelifts, where we're also close to those facial nerves to make sure that those muscles are actually moving and those nerves are still intact. So that is really good news because that would be the first thing I would worry about with this operation.
There you are, Tim.
Wow. A few months ago, the tumor was wearing me down. Since surgery, I feel lighter. I've had zero pain. It has been far easier than I expected.
That is an incredible result, and I really give props to his plastic surgeon for doing such an amazing job. There was a guy who had a mass even bigger than his though that I reacted to recently. This one will blow your mind. Take a peek at this video that I react to of a mass that is so big from the side of his face, it goes down to essentially his belly. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.